Hey guys, what's up? It's Mike. Today is December 13th, 2014, and I am officially a month post-op today. So this is my chest 1 month. As you can see, my right nipple is getting a lot of color back. It's damn near filled the fuck in. This left nipple is like it's no, it's hella slow, and it sucks because it's the better looking nipple. This one is actually a lot bigger and it's weird shape, but whatever. I don't give a fuck. But whatever. So these are my scars. They were actually a lot thinner about a week and a half ago. But life happens and scars stretch and whatever. Um, I've been using Mederma, and once that's used all up, I've already bought coconut oil, shea butter, cocoa butter, aloe vera jelly, and vitamin E oil. Have some rosehip oil coming in the mail, and I have some lavender essential oil coming in the mail. Um, So I'm gonna use all that stuff. I'm probably gonna get some extra virgin olive oil, and use a little bit of that. When I was really young, my mom used to rub olive oil on my skin. She used to do that for me and my sister, and we had really soft skin. And my skin is actually still pretty soft for being on T for 2 years. So yeah, there's that. Um, I think I might have also gotten some jojoba oil. I don't know. Whatever. Whatever I get is whatever I get. Um, But actually, pretty soon after I got the binder off, I had taken the tape off because it was itching like really weird. It wasn't my incision. It was like beneath my incisions that were itching, and then like it was just this weird reaction of this thing, and I don't even know how to describe it, but it was just weird. I don't think it was an allergic reaction because I didn't get like a rash or something like that, but I can't even describe what happened. It was just very strange. So, sent a photo to my doctor, and he told me to just take it off. I don't think it was an allergic reaction. I think it was just my skin was irritated with having tape on for so long. Um, who knows? Because I've never had problems with adhesives before, so I don't know. And I did notice that while I was dressing my nipples, it was starting like the adhesive was starting to itch, and like the tape that I had on in that area was starting to itch um sometimes, and I just think that my skin just needed a break from adhesives. But I stopped putting gauze and stuff over my nipples at 3 weeks. Which sucked because I ended up buying like two new things of like gauze like right before. Um, because I was like, oh, I'm gonna need gauze until whatever. Because I was using a lot of gauze. I was changing twice a day and or whatever. But and I just started facing the shower like a few days ago, maybe like 2 days ago. I actually rode my bike today. Um, and I rode it the day before yesterday, I think too. It was horrible. It was absolutely horrible. Um, Thanks a lot, surgery, for making me weak, but that's fine. Normally, like I'm used to riding from like Richmond BART station to North Berkeley BART station, and sometimes I would even ride all the way from Richmond to Ashby BART station. Which, if you're not in the Bay Area, you don't know how far that is, but it is pretty far to ride on your bike. Um, Especially on the kind of bike I have. I have a BMX bike, so it's not really like a bike that you would ride long distances on. Um, but yeah, it was pretty far, and I would ride my bike for that long, and I'd be fine. Like I'd do it in like 30 minutes, you know. Um, but now I can't even ride my bike around the corner to the store. But to be fair, I no matter where you enter my apartment complex, there's like a hill. There's like three entrances, and like there's a hill on each one, and so it's not like a steep hill or anything. It's just kind of like little, hill kind of. So whatever. So to be fair, there's that too. But other than that, I'm doing really fine. Trying to keep my scars nice and healthy. They are starting to stretch, which sucks, but whatever. Take the good with the bad. Um, there is a little bit of pain like in this area on both sides if I move a certain way or stretch in a certain way, which sucks. Um, I can actually lay on my stomach for small periods of time, which is awesome as long as I have a pillow. Um, so that's good. Have to like lay on the pillow, like on my torso. Like I have to have my torso on the pillow. um, I've been just sleeping on my back. I can kind of sleep on my side a little tiny bit, but when I sleep on my back, I absolutely have to hug something because when I sleep on my stomach, I hug the pillow, and I fall asleep. But on my back, I can't fall asleep, and I think it's not really so much of how I'm like what position I'm sleeping in. I think it's the hugging stuff is what helps me sleep. So I have my neck pillow in one arm, and then I have like my teddy bear for like 30 years. Yes, I sleep with a teddy bear. Well, I don't really sleep with it; it's just on my bed as decoration. But I've been sleeping with it now. But I like hug them both really tight, and like it helps me fall asleep. Um, so there's that. But yeah, other than that, I've been chilling. Yeah, it's winter break, so no school right now, and yeah, so I'm gonna make another video right after this one of how I feel about my Freedom prosthetic. So yeah, all right, guys, see you later.